Hey guys, welcome to this orientation session on Forensic Medicine and Toxicology. In this session, I'll give you a brief history of forensic medicine, an overview of this subject, and what to expect from the upcoming sessions that I am going to conduct with you. The objectives of this session: brief history of forensic medicine and toxicology, importance of FMT for an undergraduate student, how to study forensic medicine and toxicology for theory exam, practical and postgraduate examination tests like NEET or next examination. Important topic to focus on theory, practical and the PG examination. What books should students refer to for forensic medicine and toxicology? Overview of this subject, what to expect, and what is DigiNerve and how will it help the student in achieving the goals. So, a brief history of forensic medicine and toxicology. Forensic medicine has humble and ancient origins. Law medicine problems were found written in the records in Egypt, Sumer, Babylon, India and China dating 4000 to 3000 BC. Manu was the first traditional king and lawgiver in India. Manusmriti was a famous treatise where rules for marriage, punishment for adultery, incest and sexual offences were formulated. Code of Hammurabi, specified by the king of Babylon, is the oldest known medical legal code. Hippocrates, who is the father of Western medicine, discussed the lethality of wounds and contributed to the field of ethics. First description of examinations of injuries were found carved on the pieces of bamboo dating back to the Qin dynasty in China from about 220 BC. First medical legal autopsy was conducted by the Roman physician Antistius, who examined the body of Julius Caesar after his assassination in 44 BC. He noted 23 wounds on his body which resulted from blows and daggers. Agnivesha Charaka Samhita was the first treatise on the Indian medicine which dates back to 7th BC. Shushruta, who is the father of Indian surgery, gave the Shushruta Samhita in 200 to 300 AD. During the 6th century, Justinian law called medical legal experts to testify in cases of rape, criminal abortion and murder. Chinese publication in the 13th century titled Hizhuan Lu or Instructions to the Coroner dealt with findings in cases of infanticide, drowning, hanging, poisoning and assault. First autopsy, the modern autopsy, was done by Bartholomew Verignana in Bologna, Italy in 1302 AD. In Germany, during the 16th century, the Code of Bamberg brought about a requirement for medical testimony in forensic cases. This code also allowed the opening of the bodies to examine the depth of and damage caused by the wounds. Ambrose Paré, a French surgeon, is considered the father of modern forensic pathology. He studied the effects of violent death on the internal organs and wrote reports in the code, a procedure on writing of legal report in relation to medicine. In 1602, first book on forensic medicine was published by Italian physician Fortunato Fedele. Paolo Giascia published Questions Medico Legalis in 3 volumes and is considered the father of forensic psychiatry and father of legal medicine. The first recorded medical legal autopsy performed in India was by Edward Berkeley in 1693 at Chennai on a suspected case of arsenic poisoning. The first publication of forensic medicine in UK was by William Hunter in 18th century. His essays were on injuries found on murdered illegitimate children. In the 18th century, Italian anatomist Giovanni Morgagni dissected the bodies of the dead and compared the alterations in their organs with the symptoms of the diseases that had caused death. He published a book in 1761 on 640 postmortems he had conducted. The 3 great pioneers of forensic medicine born in 18th century were Johann Casper, Matthew Orifila and Mary Devergy. They devoted their life in the study and development of forensic medicine as we understand it today. In 1807, Andrew Duncan became the first professor in forensic medicine in Edinburgh. In 1858, Sir William Herschel advocated the use of fingerprint in identification of a person. Alfred Swan Taylor published the Principles and Practice of Medical Jurisprudence in 1865. In 1879, Alphonse Bertillon was the first to utilize anthropometry in law enforcement. In 1890, Sir Francis Galton systematized the use of fingerprints and its use for identification. The first chair in medical jurisprudence was instituted in Calcutta Medical College in 1845, and Dr. C.T.O. Woodford was the first professor. Dr. Jaisingh Modi was the first to handle cases of medical legal nature and published the first book in India, Forensic Medicine. Professor Alec Jeffreys pioneered the use of DNA fingerprinting for identification in 1984. This is in brief the history of forensic medicine. Now, why forensic medicine is important for the undergraduate students? Forensic medicine and toxicology, including medical jurisprudence, is taught in second and final Part 1 professional MBBS course, which familiarizes and addresses the medical legal aspects of medical practice. The broad goal of teaching forensic medicine to undergraduate students is to produce doctors who are well informed and capable of making observations and inferring conclusions by logical deductions to set inquiries on the right track in the criminal matters or medical legal cases. One of the aims and objectives of forensic medicine involves a thorough knowledge of the medical legal cases that he may have to encounter during the practice of his or her professional career, which permits the practitioner to provide competent opinions for courts in the administration of justice, consistent with the current medical knowledge and requirements of the law. It is to be noted that in India, unlike in developed countries, the bulk of medical legal work is done by doctors who do not have a PG qualification in forensic medicine. It is thus all the more necessary for the undergraduates to be taught in a more integrated manner so that they can execute quality medical legal work that would be invaluable in the administration of justice. But most of the time, almost all the students consider it as an unimportant subject which needs to be passed for the degree of MBBS. The actual significance of the subject becomes evident only when he or she starts his or her medical practice in the field. Suddenly, he or she is confronted with the law and the law enforcing people, including the policeman, lawyer, and the judge. And at that juncture, he or she finds himself or herself lacking in all practical knowledge. The inherent fear to avoid the cases or hastily deal with it may lead to trouble in a court of law. However, if the medical practitioner acquires a minimum level of understanding of the legal system, observe and analyze the cases judiciously and act patiently, then most of the problems can be solved. So you should be more serious while studying this subject of forensic medicine and toxicology. Now, what are the books recommended in the subject of forensic medicine and toxicology? I'll recommend only one book, that is Review of Forensic Medicine and Toxicology by Dr. Gautam Biswas. The 5th edition is the latest one. Why I am recommending it will be clear from this video. Now, organization of this learning process. It is competency based. The NMC guidelines have given 140 competencies and 22 skills. And how this teaching learning method is there? It can be taken in the form of lectures, small group discussion, self-directed learning, integrated topics and practicals. In this lecture series, we'll cover the important competencies. Although the classes will start in your second MBBS, but the professional examination will be held in final part 1, along with other subjects like ENT, Ophtha and preventive and social medicine. The total marks, they are 200, theory is 100, practical is 100. The theory paper will consist of long answer questions, problem-based learning, short answer questions and MCQ, which should not be more than 20% of the marks. And the total marks is 95 plus 5. This 5 is for a question on ATCOM, which is Attitude, Ethics and Communication. So, a question should be based on this. So, 5 marks is given for a question on ATCOM. In the practicals, there will be spotters, skill station, analytical skill testing and performance station. So, some practicals will be there, you have to perform. In the PG entrance examination, there are nearly 8 to 10 MCQs which are asked regularly. Mostly they are direct questions, easy to answer without any ambiguity. The image-based questions are also asked nowadays. Problem-based questions will be asked, easy to score marks on this subject of forensic medicine and toxicology. The important topics from which the questions have been asked are legal procedure, identification, thanatology, asphyxia, injuries, rape, general toxicology, organophosphate poisoning, snake bite and medicinal poisoning. So you can concentrate these topics. The teaching hours that has been stipulated by the NMC is in the second MBBS 50 hours of teaching should be there, in the third MBBS 75 hours, total is 125 hours. I have tried to cover this syllabus in 60 odd lectures and these lectures may be exhaustive, but nevertheless I have tried to cover most important ones through this series. You can divide the subject of forensic medicine into various subtopics: medical jurisprudence and legal procedure, forensic medicine including sexual jurisprudence, forensic psychiatry, toxicology. You can also have forensic serology. So, there will be 1 or 2 lectures on blood, seminal stain in this series. Some important definitions. Forensic medicine is the application of the principle of knowledge of medical sciences to problems in the field of law, so as to aid in the administration of justice. The word forensic has been derived from the Latin word forenses, which implies forum. In Rome, the forum was the meeting place where civic and legal matters used to be discussed by those with public responsibility. Forensic medicine is also known as legal medicine or state medicine. Medicine carries wide significance, science for preserving health and effecting cure. From the interactions of these two professions, that is medicine and law, has emerged the subject of forensic medicine. This involves, on the part of the medical practitioner, besides a thorough medical knowledge and understanding of the certain provisions of the law of his or her country, like the IPC, CRPC or the IEA. This is the Indian Penal Code, Criminal Procedure Code or the Indian Evidence Act. Now, what is medical jurisprudence? Juris means law and prudentia is knowledge. It is the application of knowledge of law in relation to the practice of medicine. It deals with those relationships of a doctor which are generally recognized as having legal consequences, like doctor-patient relationship, doctor-state relationship, doctor-doctor relationship. Toxicology, it is a science dealing with the properties, action, toxicity, fatal dose, detection, estimation, treatment and autopsy finding in relation to poisons. Forensic toxicology deals with the medical and legal aspect of the harmful effects of chemicals on human beings. 4 attributes are needed for the success in the field of forensic medicine and toxicology: power of observation, power of deduction, wide range of exact knowledge and power of constructive imagination. Experience, common sense and willingness to consider other possibilities are essential. Mostly it is a common sense which helps a lot. I'll just give you an overview of this subject, what is to expect in this following sessions. Medical jurisprudence, National Medical Commission, the powers and functions of NMC will discuss regulation of medical education in India, professional misconduct, medical negligence, the courtroom conduct and etiquettes, what are the various types of evidences. In identification, we'll discuss about how to determine the sex from the different skeletal structures, skull, pelvis, mandible, how to determine the age of the person from the ossification centers, how fingerprints are useful for identification, superimposition technique, how tattoos and scars can be useful for identification. In autopsy, how to conduct the autopsy, what are the various types of incision, how the organs are taken out, what are the instruments which are required. The findings that you see in various cases, there can be atrophy of the brain, fibrosis, previous infarct, polycystic kidneys, mesenteric hemorrhage. You may even find a pacemaker in the heart. You may find a stab wound on the chest, corresponding injury over the heart. Then the question may be asked whether it is suicide, homicide or accident. All these questions will be discussed and you have to answer in the court of law also. In thanatology, you have to see the various changes which are seen after death. You have to determine the time since death from the various changes that you see, as well as during autopsy you have to find the cause of death. So we will discuss the various changes that are seen after death. If you find some mutilated bodies in exhumation cases or skeletal remains, how to identify the person or determine the cause of death. We will discuss all this. Asphyxial deaths, what are the findings, whether it is hanging, strangulation, the various types of hanging, what are the significance of all this finding, how to preserve the ligature, whether it is suicide, homicide. So all these questions will be discussed. Smothering, choking, findings in drowning, whether it is antemortem drowning, post-mortem drowning. In the injuries, very important, we'll discuss about the various types of mechanical injuries, abrasion, bruise, contusion, lacerations, whether it is suicidal, homicidal, accidental. All these things will be discussed. In firearm injuries, we have to determine the type of firearm, whether it is a rifle or a shotgun, the range, the distance between the victim and the assailant. So various types of firearms, how to identify the firearms. In the regional injuries, the injuries which are there on the skull, on the pelvis, on the chest, on the scalp, we'll discuss, on the heart, liver, internal injuries. Intracranial hemorrhages, very important. What are the various types of intracranial hemorrhages, the signs and symptoms, how to diagnose. Thermal injuries, the burn injury, flame burns, the frostbite, the injury because of cold, electrocution, lightning injury. The medical legal aspects of injury, very important, whether it's a simple hurt, grievous hurt, whether the injuries were sufficient to cause death of the person, whether it is a suicide, homicide or accidental injuries, all these will be discussed. Infanticide, whether it is a case of infanticide, what was the age of the fetus, how to determine the age of the fetus from the various features, the ossification centers, signs of live born, dead born, stillborn, these will be discussed. In sexual jurisprudence, the abortion, the findings which are there, whether it is a criminal abortion, whether it is as per the provisions of the MTP Act, pregnancy and delivery, the signs and symptoms of pregnancy and delivery, medical legal aspects of pregnancy and delivery, what are the conclusive signs of pregnancy. In sexual offences, rape is very important. You should be knowing how to examine a survivor of rape and how to formulate an opinion. In sodomy cases, if it is non-consensual, the findings. In passive habitual partner, what are the findings? Sometimes you may find the peculiar objects within the GIT, so you can have to find out the cause of it. The paraphilias, we will discuss about that. In forensic psychiatry, we will discuss the common symptoms seen in psychiatric cases like delusion, hallucination, illusion, etc. The classification of mental illness, the civil and criminal responsibilities of a mentally insane person or mentally ill person, and the Mental Health Care Act 2017. In toxicology, we'll discuss the various types of poisons which are common in and around us, Corrosive poisoning, the features of corrosive poisoning, the features of metallic irritants like arsenic poisoning, mercury poisoning, copper sulfate poisoning, lead poisoning. If it is in snake bite poisoning, what are the features, the signs and symptoms of bite from common venomous snake, the treatment of snake bite poisoning, neurotic poisons, the various types of neurotic poisons and its toxicity like opium, dhatura, alcohol intoxication, how to diagnose a case of alcohol intoxication, drunkenness. In case of asphyxiant poisons like carbon dioxide, carbon monoxide, acetylene gas or H2S poisoning, what are the features of it and how to treat such cases. Agricultural poisons, they are very important, it's very frequent. Suicidal poisons with organophosphate, how to treat such cases, what are the signs and symptoms in various agricultural poisons, alphos poisoning, OPC poisoning. Medicinal poisons, when medicine is taken in toxic doses, it can be fatal. So we'll discuss common medicines and its toxicity. So this is what you can expect in broad in this current lecture series. Why will you choose DigiNerve? It's a competency based learning content by experienced teachers and authors. There is no compromise on the content. The content is the king here. Bridges the gap between the professional examination and the PG examination or the NEET examination. Prepares both for professional and the PG entrance examinations. It provides a systematic approach to the subject, covers the entire syllabus within few lectures. There is no need to take separate coaching for the PG or the next examination. It's not unlike other platforms where the teaching is in bits and pieces based on the MCQs that they are dealing with. So there is no gap in learning process. Most sessions follow a case study based approach supported by discussion of the topic. Lectures are richly illustrated with lots of videos, animation, gross and microscopic images, tables, flowcharts, differences as well as mnemonics for easy understanding and quick recall. Make it easier to understand the concepts and relate better with the textbook. Applied aspects discussed wherever needed. MCQ and image-based questions discussed after completion of a topic or a subtopic. Points to remember at the end of each session to help the PG aspirants refresh and revise their knowledge. This will also help in last-minute revision before examination. I would like to acknowledge these following persons who have helped me with the slides and videos. Out of this, I would like to thank the most Dr. Vishwakan B, Murugesa Bharati and Tejpreet Singh. I would like to offer my apologies to all my colleagues and friends whose names I have omitted inadvertently. At the end, I wish you a very happy and enjoyable learning experience. Thank you.